Well, social distancing, financial stress, and health concerns can take a really big toll on our mental health. The Rebound Indiana is sharing advice and resources you can use right now to cope with the impacts of this pandemic. You might find yourself staying up later these days, maybe scrolling through social media, or just worrying about a number of issues. So Scripps reporter Megan Thompson shows you why being tired is not the worst issue tied to a lack of sleep.
These are healthy, normal people that are usually going about their lives, but now are starting to be more depressed.
Not surprised, but still concerned. Dr. William Kilgore and his team started collecting data back in April, specifically on how people are feeling.
And we're finding that the rates of suicidal thoughts are about 8 times higher than we normally see.
Dr. Kilgore, a psychiatry professor at the University of Arizona. So far, they've seen depression rates 3 times higher than normal, and those meeting the clinical criteria for post-traumatic stress disorder 4 times higher.
So it's about the rate that we see among people coming back from combat in Iraq and Afghanistan.
But a way to take action against the struggles of mental health lies in lying down. Sleep, a somewhat solution.
So it's not that being afraid makes you more suicidal. It's that being anxious about COVID impairs your sleep. And when you're not sleeping well, you're not thinking straight.
Dr. Kilgore explains less sleep means less engagement with the frontal areas of the brain, impacting your thoughts and decisions. To shut down and rest, Dr. Kilgore stresses the importance of going to bed at the same time and waking up at the same time every day. Plus, put your phone down. Light plays a big role.
Maybe 9 o'clock at night, and you're looking at your blue screen for a while, and it tells your brain that it's actually only 6 o'clock. So your brain doesn't want to go to bed for another 3 hours.
So even if you feel uneasy, it's important to find ways to rest easy.
Well, experts say if you're struggling with suicidal thoughts, you can talk to a counselor or reach out for help. Available 24 hours a day at the National Suicide Prevention Hotline. That number is 1-800-273-8255. You can also visit the BeWellIndiana.com, and you can find additional resources right now at theindychannel.com/rebound.